Infertility is known as the inability to conceive a child through natural means. Infertility can affect both men and women equally. An estimated 10 to 15% of couples have trouble getting pregnant or getting to a successful delivery. Most couples achieve pregnancy within 1 year of trying, with the greatest likelihood of conception occurring during the earlier months. Only an additional 7% of couples will conceive in a second year. As a result, infertility has more specifically come to be defined as the inability to conceive within 12 months.
So what causes an individual to be infertile? There are a variety of causes linked to infertility. The Center for Disease Control names a few factors. A female ovarian function, whether or not the woman is ovulating regularly, or the age of the eggs. Tubal patency, which refers to the fallopian tubes being closed, open, or swollen. When damaged or blocked, they keep sperm from getting to the egg or block the passage of a fertilized egg to the uterus. Flaws in the regulation of reproductive hormones, or uterine or cervical cancer. These can both interfere with implementation or increase the likelihood of a miscarriage. Causes in men can also include a variety of factors such as lower absent sperm production. If there are not enough sperm, the chances of fertilization are decreased. Abnormal sperm function. Sperm can have low motility and not be strong enough to penetrate the egg. Varicocele, which is a condition that creates the development of varicose vein around the testes and is a very common cause of infertility in men. And male sperm can also be affected by environmental factors, such as smoking, trauma to the testes, or even an overexposure to chemicals or toxins. So is infertility hereditary or genetic? The answer is quite complex and confusing to some people. Infertility is not a disorder that can be passed down from generation to generation. However, conditions that can cause infertility are often hereditary. For example, a condition called endometriosis is a specific disorder that can be hereditary. Similarly, infertility can be affected by genetic factors. For example, if a chromosome develops abnormally, or if there is a simple gene defect passed from parent to child. The Reproductive Science Center identifies this as translocation. Infertility affects the reproductive system. This means it affects the human body's ability to reproduce and conceive a child. A woman's reproductive system includes the following organs: the ovaries, fallopian tubes, uterus, vagina, vulva, mammary glands, and breasts. A man's reproductive system includes the following organs: the scrotum, testes, spermatic duct, sex glands, and penis. Aside from the obvious answer of the reproductive system, infertility disorder can also be highly affected by the immune system. A stable immune system is essential, as infections can lead to infertility. A sturdy skeletal system is also important in order to protect the reproductive organs from being damaged. And the endocrine system must be releasing the correct amount of hormones to regulate the growth and general body function within each partner.
The main symptom of infertility is the inability to get pregnant. Symptoms in males are harder to notice, but they are abnormal shaped sperm, poor sperm quality, or the sperm cannot attach to the head of the egg or penetrate the egg at all. Males with a sperm count of that is 10 million per milliliter or lower is considered to be low and will affect their ability of impregnation. The usual male has 20 million sperm per milliliter. Some signs in females are a menstrual cycle lasting way too long, such as 35 days or more, or too short, which is normally 21 days or less. A female being irregular or having an absent period can be a sign of no ovulation, which must occur to get pregnant. When to seek help from a doctor depends on your age. If you're in the early 30s or younger, most doctors will tell you to attempt pregnancy for at least a year before testing or treatment. If you're between the ages of 35 and 40, talk to your doctor after attempting pregnancy for 6 months. If you're older than 40, doctors normally want to start treatment or testing right away. Your doctor may also want to begin testing on your partner as well, because infertility can be seen in both genders. If you have a medical history of irregular or painful periods, pelvic inflammation disease, repeated miscarriages, or endometriosis, You may need to treatment or testing done right away without concern of your age.
Across the United States, 6.7 million women suffer from infertility, which is about 11% of women at a reproductive age. It isn't feasible to get an accurate data set on global infertility in men, but a global estimate of women suffering from infertility is available thanks to the World Health Organization, that reports that of 190 countries surveyed, 1 in every 4 women suffers from infertility. It's no secret that our world is operating over the sustainable capacity for human beings. Because of this, infertility is beneficial to the rest of the world because it results in less people. However, individuals suffering from infertility still experience heartache and frustration.
Unlike many other diseases, infertility does not have a huge impact on society locally, nationally, or at a global level because Earth is overpopulated. However, for the couple that is diagnosed, this could be devastating. Many women find themselves feeling useless, inadequate, or worthless to society if they are unable to reproduce. Due to the U.S.'s medical advances, we do not see as high rates of infertility as many other areas around the world. Being diagnosed infertile does have consequences, but couples can't lose hope for new discoveries in the scientific world. Encouraging options such as visiting a fertility doctor or adoption is needed for support. There are always options out there, and thankfully society has made many of those possible for those who suffer. Remember, it is nobody's fault, and you are never alone when it comes to being infertile. There are always options or choices to be made, and support is just right around the corner.